recording. I think we're recording now. Hello, Jen. Thank you for joining us. As always, this is the Aspergillosis Trust. We are doing a couple of interviews with people who can help us understand our diseases and related topics again. And somebody suggested I talk to you, and perhaps it would be good for our viewers if you could introduce yourself.
Yes, thanks very much for having me, Bart. My name is Jen Kilduff, and I'm a respiratory physiotherapist working in the Royal Brompton Hospital. And I primarily work with patients with bronchiectasis.
Yeah, and let's actually talk about that for a bit. Our group is mainly people with Aspergillosis, but I think there's a lot of people with Aspergillosis have bronchiectasis. Can you explain that a little bit?
So bronchiectasis, I suppose what it is just kind of a dilation of the airways. So bronchi meaning airway, ectasis meaning over distension or dilation of a tube. So that's kind of what it is and how it's causing disease. Why the airways might be distended is for a whole host of different reasons. So sometimes it's due to kind of having infections. So for example, measles or TB or something like that. It could be due to sickness in early life. So for example, being born premature can put you at risk of bronchiectasis. If you've been intubated in your early life, that can also put you at risk. If you've got some sort of other airway disease that can cause bronchiectasis, so for example, cystic fibrosis, primary ciliary dyskinesia, asthma, COPD, those things could put you at risk of bronchiectasis. Anything that hampers with your immune system, so any sort of immunodeficiency that you may have, that will put you at risk of infections. And also if you've got a connective tissue disease, so for example, lupus, Sjögren's disease, that can also affect bronchiectasis. So I suppose there's a large reasons why you might have it. And with Aspergillus, I suppose it's an opportunistic bug. So not everybody who comes in contact with Aspergillus is going to become unwell. You're much more at risk of getting the symptoms from the bug if you have any sort of structural lung disease like bronchiectasis. So that's why you might see the two kind of going hand in hand.
Yeah, thank you very much. That's actually really helpful. I didn't know much of this. What I did know is that there are a lot of people with Aspergillosis who have bronchiectasis, but not everybody who has Aspergillosis has bronchiectasis and the other way around. Now, the most interesting thing, and this is actually why we're talking, when I was diagnosed quite a while ago, and I had this view, oh, you have a medical treatment, that's what you do. This is and in many ways that's true, right? And we spoke with Anand Shah about this. Medication is very helpful in managing these conditions, and in many ways it works. However, they also told me, that was in Manchester in these days, they said, oh, there's another thing you need to do for bronchiectasis, which is physiotherapy. And I said, what? And can you explain that a bit more now?
Yeah. So as physiotherapists, there's loads that we can do to help people with bronchiectasis. So the first role that we would have is to help people manage their airway clearance. So like I said, the bronchiectasis, it's a dilation of the airways. The airways are wider than usual. And in the normal person or in somebody that doesn't have dilated airways, there's kind of tiny little hairs, so a little bit like nose hairs all up and down the airway. And those hairs kind of work in such a way to bring the phlegm right up so that it's easy to cough out if you are having an infection. So anybody with kind of normal, healthy lungs, it's normal to have chest infections, but you'll find they'll often clear quite quickly and maybe without antibiotics, and they'll just be able to cough the phlegm up themselves. So with someone with bronchiectasis, that movement of phlegm is often not there. So we can teach kind of breathing techniques to replace the movement that would have been there to help clear the phlegm. And while it's important to clear the phlegm because, you know, a lot of people suffer with having a lot of phlegm, it can provoke cough then, and it can impact you in your daily life. I guess that, you know, the bugs are essentially sometimes living in the phlegm. So getting rid of the extra phlegm that you have on board can also help with things like your appetite, your energy levels, how well you're sleeping, and that kind of thing.
Is this, thank you, that's really helpful. Is this something that you would recommend that you do if you have an infection or you think you have one, or is this something you think actually this should be part of your daily routine?
If you have bronchiectasis, you should be doing some sort of airway clearance as part of your daily routine. And then I guess if you're having an infection, what we'd always recommend is that you have kind of a, like, we call it an escalation plan. So when you're well, this is your routine. And when you're unwell, usually is that you bump up your physio. It might be different from person to person. Some people have certain antibiotics they have to take if they become unwell, maybe steroids. So we would have a physiotherapy plan that aligns with that. So
yeah,
you might bump it up to twice a day when you're unwell, something like that.
And I think it's probably not a good idea to sort of demo this today. But what would you think would be a basic plan, a daily plan for somebody with like reasonable bronchiectasis?
So we would usually start somebody off on a technique that's called the active cycle of breathing technique. And essentially all it is just taking deep breaths and then doing kind of a huffing breath to help move the phlegm.
Yeah.
And that is kind of the starter, I suppose, of what we would suggest if you have bronchiectasis. You know, there's no risks to it. It's free. You don't need any equipment. Yeah. But you would just need to see a respiratory physiotherapist. So the current guidelines for bronchiectasis that are laid out by the British Thoracic Society would recommend that if you have bronchiectasis, you should be able to have access to a respiratory therapist. Yeah. And be taught those breathing techniques. So I would say, one verse.
Yeah, let's get these 2 points very clear. Number one is, if you have bronchiectasis, ask your GP or your respiratory consultant to talk to a physio.
That's right.
Yeah. Number two is, the most common exercise is active breathing with a huff, which will then provoke a cough. That's where we are so far. Yeah. And that's, is there anything else that you think would be done daily?
I suppose other things then that we'd recommend are, you know, staying active. So a lot of people with bronchiectasis or anybody that has lung conditions, it's a lot more difficult to exercise. And that could be for a whole host of reasons, like what I'd mentioned. Sometimes if you have a lot of phlegm on board, when you start exercising, you can start coughing. And that could be really difficult if you're doing something like you're in a football team, or maybe you're out for a run somewhere in a public place, and people can get quite self-conscious about that. So alongside keeping on top of the phlegm, keeping active is a really high priority. So, you know, we usually just advise, if it's something that you like and that you enjoy, that you're getting those activity levels of about 150 minutes per week. That will also help with your the symptoms of respiratory disease. So we'd be giving out airway clearance advice and exercise advice. Other things then that you can do to help are just making sure that you're hydrated through the day. It seems like a bit of a no-brainer, but being dehydrated will affect your phlegm and make it a little bit more sticky. So each day you should be trying to get kind of about 2 to 3 liters of water in. And then I guess apart from day-to-day stuff, other things that physiotherapists can help with are management of your sinuses. So a lot of people who have chest infections can also have blocked sinuses. So we can give advice about kind of different rinses and techniques to keep that clear. And then another common problem would be anybody that's having a chronic cough or that's coughing a lot, they're at risk of having kind of a bit of stress incontinence or urinary leakage. And that is really common with patients with bronchiectasis. So we can kind of screen for that, and we can give kind of basic pelvic floor strengthening exercises as well. Yeah,
perfect. And actually, one point really resonates with me. I'm very lucky that despite having aspergillosis and bronchiectasis, I can go running. But as you said, the first 5 minutes is just coughing, and occasionally people look like, "What is this guy doing?" Like, but I would say to everybody who does cycling or whatever, it's fine. Just get, you know, it's fine. Just do it, because the benefit is just so much bigger. And then if people have infections, what do you think would be the guidance in terms of airway clearance and so forth?
Yeah, so usually if somebody's having an infection, it would be to increase the airway clearance that they're doing. So maybe increase it to twice a day, or for example, it might be that you do it for 10 minutes or 15 minutes per day, but when you're unwell, you do it until you feel like you've cleared your chest or until you're tired, something like that. So we usually kind of increase what they're doing.
Yeah. Okay. So I think this is really good. This is kind of in line with what I heard before. And to summarize, if you have been diagnosed with bronchiectasis, you should see a physio. They will teach you these techniques, you know, the huff and the controlled breathing. Exercise is great. If you can do exercise, please do. Don't worry about being seen to cough. And hydration is really important. Drink water. And if you're unwell, try to do more airway clearance.
Yeah.
I think that's kind of the key guidance that we have here, right?
That's it. Yeah.
Yeah. All right. Well, thank you. I think we'd like to keep these videos short, but thank you very much, Jen, for joining us. I'll be posting this. I'll stop recording that way.